The title of my speech is Cholesterol Causes Heart Disease. The time, 8 to 10 minutes. And I have to cue something really quick. I have to cue up the PowerPoint for myself. Good? Good. Cholesterol causes heart disease, right? That's what we all know to be true. I'm going to tell you a different story. We're going to be talking about, come on, clicker.
Sometimes you have to advance the first slide and then it goes after that.
Okay. Quick second.
Technical difficulties.
Of course. Try and figure it out, see if
Let's see. Yep,
yeah.
perfect. Now we're running. So we're going to be asking some questions and talking about these issues. What is cholesterol? Is cholesterol bad or good? What does it mean if it's high or if it's low? Actually, what type of testing should you do? And the most significant part of this is the insights and the conclusions based on all this information. It's not going to be what you think. So what is cholesterol? Cholesterol is a fatty substance that's stuck onto a protein, and hence the word lipoprotein. So we have high density lipoprotein, HDLs, which is supposed to be the good cholesterol. And then we have the LDLs, the bad, evil cholesterol. My point here is to tell you there's not bad or good cholesterol. It's fine, it's actually good stuff. Cholesterol is essential for your brain. It's essential for all of your cell membranes in your body. It's essential for your hormones, protects you against inflammation. Lots of good essential reasons for cholesterol. The reason it's described as bad or good is because if you can see the liver, that picture of the liver there, LDL cholesterol, the bad cholesterol, is sent away from your liver and supposedly is going to be embedded in your coronary arteries of your heart. That's what's said, and that's why LDL cholesterol is supposed to be known as the bad cholesterol, whereas HDL comes back from your tissues back into your liver, so that's why it's supposed to be good. And I'm saying supposed to be bad and supposed to be good. Very key points there. How do you get your cholesterol high? This is a major problem today, and I'm saying it's not really a major problem at all. Genetics play a very small role in this. Diet is the critical factor. Now, what are we all told about cholesterol? How do we raise our cholesterol? It's eating what?
Fatty foods.
Thank you, perfect. Eleanor, you're just on to the right track there. So, saturated fat, red meat, don't eat fat, it's absolutely evil, it blocks your arteries and does all of those bad things. When in fact, the truth of it is what Eleanor said, it is starch, sugar, and alcohol. Those are the evil foods that raise your cholesterol. And that's the truth. And this is not my opinion. It's not only my opinion, it's actually embedded in the science. Lifestyle. What type of lifestyle could contribute to high cholesterol? What do you think? Stress can do it. Yeah, absolutely. That's a good point. Stress can do it. Lack of exercise, and certainly eating bad foods, eating fast foods, drinking soda, all those things. Something else is autoimmune conditions, autoimmune disease. When you have high levels of inflammation because your immune system's actively attacking your body tissues, that raises your cholesterol levels. Cholesterol sent out, the LDL, the bad cholesterol, sent out from your liver to put out the flames, the inflammation in your body. Kind of a smart system there. So what about low cholesterol? Low cholesterol comes about with an extremely low-fat diet. Cardiologists love low cholesterol. And if you look at actually the science behind that, the lower your cholesterol is, the closer you are to death. And this is true. Liver dysfunction is another factor that plays a role in lower cholesterol. If you have low cholesterol and you're not on a statin drugs are the cholesterol lowering drugs, you have to look at your liver. And I would say you need to look at your liver if your cholesterol is high as well. Statin drugs, by the way, are the #1 best-selling drug today. Just to let you know. And here's a key word here, the cause. The cause, unfortunately, in healthcare today is never talked about. Matter of fact, if you go to your doctor, what do your doctors say? Oh, your condition, your problem is genetic and it's because you're getting older. Neither of which you can do anything about. Can't change your genetics, right? You can't lower your age. So, well, and these things are happening to you at this age, so what do? You just have to depend on what they tell you and do what they say. I would say differently. I would beg to differ and say, look for the cause of problems. Now, let's talk about testing. We've all had blood work done, everybody, pretty much. So the standard panel is called a lipid panel, and it measures your total cholesterol, HDL, LDL, and another one called triglycerides. Here are, and I would really recommend that you write these down and tell your doctor you want to have these tests done, these other important markers. We need to connect your cholesterol, your lipid panel, with blood sugar markers, such as fasting blood glucose, which is a 12-hour fast, your hemoglobin A1C. That test, and it's on the news, it's in commercials now because Ozempic's gonna fix everything for you. A1C is the last 3-month averages of your blood sugar. Now, keys here, and I bolded them and made them large for you to notice these. Fasting insulin. Fasting insulin. High insulin is what is at the source or causal level of heart disease. High insulin. Well, gosh, what raises insulin, might you think? What do you think? What raises insulin, Eleanor?
Sugar.
There you go. Starch and sugar and alcohol. Another one is C-peptide. C-peptide is a measurement of how much insulin is being secreted by your pancreas. Another good thing to know. This is one that's a really critical one, the LDL patterns. For doctors to just blatantly prescribe statin cholesterol-lowering drugs without doing the LDL patterns as well as ApoB is not good. Maybe it's criminal. Because if you have pattern A, let's just talk about LDL pattern A. Pattern A are the big fluffy particles that your cholesterol could be 900 and it doesn't do a thing to you. Here's the critical factor. LDL pattern B, bad, stands for bad, that's how to remember it. It's the small dense particles that can embed themselves or wedge themselves in between the endothelial cells of your arteries. Pattern B. So is it cholesterol though, even pattern B, that causes the damage? I suggest not. It's what causes those problems to be high in the first place, which is starch and sugar and alcohol. Apolipoprotein B, a really advanced marker, but you can ask your doctor to do it. That gets high, it's a pretty significant cardiovascular risk factor. And I would say this, what raises LDL pattern B, the bad, and ApoB? Insulin, high insulin. What raises high insulin, what creates high insulin? Starch, sugar, and alcohol. Here's an example of the patterns, the LDL patterns. On the left side of your screen is the large particles, and the right side would be pattern B, the small dense particles, just to give you a visual on that. Here would be the ApoB, apolipoprotein B. This is just a protein that's stuck onto your LDL cholesterol. And again, think about this. What raises your ApoB and what raises, again, what's causing them to be high? The LDL pattern B, high insulin. So I'm saying ultimately, the ultimate problem and destruction is high insulin from the foods that we eat, which is starch, sugar, and alcohol. Cholesterol, and we're going to talk about this in just a second here. These are the things to remember. What's common in high cholesterol, LDL cholesterol, right, the bad cholesterol, ApoB, and high pattern B is high insulin. Critical to remember that. How about this? Autopsies for arterial plaque, the plaque that's in your coronary arteries that supplies your heart. The most major component is oxidized seed oils. Let's talk about oils for a second, because we all would prefer to not have heart disease developing, right? We don't want heart disease. Oxidized seed oils. Seed oils are sunflower oil, safflower oil, palm kernel oil, canola oil. Dreadful things to put into your body. What is the most stable oil to put into your body?
Olive oil, extra virgin olive oil.
Those are good, but the
Avocado.
most, even better than that.
Avocado oil?
Coconut oil.
Nope. Saturated fat. Oh my gosh. Boom, mind blowing. It is the most stable fat. Matter of fact, you probably heard about this, that if you cook with butter, you don't damage the oil. Look this up. Test everything I'm saying, but you look it up and compare the stabilization or the oxidation of different oils and fats. You will find that saturated fat is the most stable oil that you could put into your body. And hence, probably the best oil to put into your body. Completely opposite of what we have all been told.
That's a lie.
I know. So now, what causes heart disease? Starch, sugar, and alcohol. What raises LDL cholesterol? Starch, sugar, and alcohol. Same cause, but there's not a connection. Think of cholesterol as the internal scab for your body. Fall down, scrape your arm. The next day you have a scab forming on the outside to heal up that tissue. And certainly, yes, they'll find cholesterol in the midst of or on top of plaque in your heart. But you want to prevent that in the first place. That's the symptom. That's trying to heal the tissue. Prevention in the first place is starch, sugar, and alcohol prevention. Getting that out of your diet, that's what's so critical. So I didn't leave you with just my opinion, right? Here's a few references. I got 2 pages of references for you, just to let you know. So the thing to remember, starch, sugar, and alcohol, the cause of heart disease.